What's wrong with the modern diet? We
eat so-called sick animals.
What causes bloating?
Such a healthy worm, if it starts pooping, nobody will be left unaffected.
And what are the symptoms?
There won't be any poop at all.
Hello friends, today my guest is Dr. Vyalov Sergey Sergeyevich, candidate of medical sciences, gastroenterologist, hepatologist, member of numerous associations. He is among the top 5 best gastroenterologists in our country. Moreover, according to doctors.
Hello.
Hello, I'm very glad it worked out, very glad you came. I have a lot of questions.
Let's do it. These
questions, including some suggested by my dear viewers, they are very interested in your opinion, because whenever you dig into any problem, there are always 10 different answers from different specialists. One person insists their way is right and calls others fools. Public media often takes articles out of context, declares what's right or wrong, and makes it hard to know who to trust. That's why I decided to invite the best and let the best tell us what's right and what's wrong. First,
I apologize for interrupting. I just wanted to add, of course, regarding the interpretation of research, because nowadays there is a huge amount of information available on the internet, and it's presented by various experts and pseudo-experts, and it's supposedly based on research results. But we both know that any research can have varying degrees of reliability, varying levels of evidence, and to varying extents we can trust it. And if you take a paragraph out of context, it can give the complete impression that something is scientifically proven, even though in reality it can be exactly the opposite. That's why you should understand research instead of just trusting those who popularize it for their own purposes.
Sometimes a study is published, but 3 years later it's retracted due to lack of proof, unreliable info, failed verification, or no approval from the medical committee. That's why, of course, it's very difficult if a person doesn't have a medical education. Basically, everything seems true. When I ask what's the difference between a doctor and a non-doctor when they're Googling or searching PubMed or anywhere else. A doctor, in principle, can use their own knowledge and education to determine what's false and what's true. Will you help us with this today? First question, what's wrong with the modern person's diet?
The modern person's diet, of course, has its good sides. In many ways, it's convenient because in most cases it saves time. And we do devote a certain portion of our diet to semi-finished products and some convenience foods. For example, we buy something that's already packaged at the store. Then we come home and heat it up. Full-scale cooking often isn't possible, especially at work or elsewhere. And this brings its own negative element. A negative element primarily to the composition of the products, because not all products are, to be continued, subjected to reheating and quick thermal processing. That is, they are already processed or have processed from the start. We don't have a term that precisely describes this, but in the West, they do. This is processed food, and ultra-processed food. And of course, they carry risks since certain substances are added to this kind of food. Well, and regarding, for example, the intestines, a lot of research has been done. The risk of intestinal inflammation rises 2 to 8-fold, along with the risk of intestinal cancer. Unfortunately, because of these food modifications for the sake of consumer characteristics, the quality of products, of course, has changed. Because, for example, 100 years ago, chickens were raised in villages and fed certain foods. But today, perhaps the advantage is that there are fewer parasites. But there is also a downside, because now they're raised on some kind of artificial feed with a fixed composition and fixed ingredients. And that's why the quality... That's harsh, of course, so to speak.
There are people like that, just telling it like it is.
An animal's body changes entirely depending on its diet, to be continued. And we probably also, in a sense, become different in quality, because we consume this food, which, even if it's not refined, has a different composition.
When I go to the village and they give me a village chicken, even the leg is tough, and it's like wood. And I would even say it's not as tasty sometimes, because you have to tear it off. This animal fought for its life. That is, the meat is so dense.
Brown.
Yes, brown, and of course it's very different in terms of nutritional value. It's not just chicken. I understand that all this is due to the fact that the amount of food humanity needs is growing, and unfortunately we have to produce it all quickly. And products, let's say, I don't know, watermelons, tomatoes, anything, they grow faster and don't have time to fully develop, of course. So it's not just about cabbage, it's any product. That also includes nutritional value. It should be there. Proteins, fats and carbs are important, but you also need vitamins, minerals and other nutrients. These don't have time to build up.
So let's draw an analogy. We are basically eating so-called sick animals. Let's take a goose that's fattened up and made into foie gras. Foie gras is actually a fatty liver disease.
Cirrhosis, fatty hepatosis, yes.
If you eat a bit more, you'll also get cirrhosis. The only difference is one stage of fibrosis. And if we consume such food, we create all the conditions for these diseases to develop in us as well. But you can't. You can't call the food we eat sick animals in the sense that they are not completely sick, they're just unhealthy and have some disorders. Eating animals with disorders causes us to develop similar disorders. That's why there's only one solution: to somehow adjust your diet and balance it by consuming some additional foods.
As they say, we are what we eat. It's very simple.
Even with Aristotle.
We drink coffee, so my first question is, how do you feel about coffee in general? What's your attitude towards it?
Positive. It depends on the coffee quality. Instant, whole beans, and different types all offer a range. So, if we take normal high-quality brewed coffee, for example, then in principle it has quite a good effect on the body. We know, for example, that coffee, thanks to the tannins and other substances it contains, helps prevent liver fibrosis. And if fibrosis has already occurred, it can even have a reducing effect on liver fibrosis. Well, besides that, there have been many studies on diabetes. And for example, if a diabetic drinks coffee, they can reduce insulin resistance. There are a huge number of studies on melanoma prevention in countries with equatorial climates. When they drink coffee, indeed, the risk of melanoma cancer becomes lower. So in this sense, of course, it is definitely not harmful, and maybe it even serves some useful function. But its stimulating effect may be a limitation only for certain specific categories of people, and mainly this concerns hypertension. And
how much should you drink?
Well, regarding fibrosis,
if we're talking about health, for example, where is that line? Well, probably 20 cups of coffee a day isn't very healthy. So how much do you recommend your patients drink to get the benefits it provides?
Studies have evaluated 4 to 5 cups of coffee, meaning 1 espresso supplemented with water, milk, or something else. The first 3 bring additional benefits. The 4th affects and strengthens the heart muscle, but the 5th is useless. So basically, you can stop at 4.
Which coffee is healthiest? Ground coffee?
Yes, A.
Which brewing method is better? Some prefer drip coffee makers with filters. Well,
there haven't actually been any such studies, so we can only make theoretical assumptions.
And this encapsulated coffee, that's coffee. Or you need it to be freshly ground, like in a machine, and prepared right away.
Let's return to botany for a moment. It turns out that coffee is a bean. The bean has a shell that protects the beneficial substances inside from external influences. That's why it's best to grind the coffee and brew it immediately after grinding. As
in coffee machines, it stays until you press a button.
Yes, if we break this shell, the substances inside are exposed to peroxidation and destruction. That's why there will be less benefit. For example, nuts are now recommended to be soaked and stored for a long time. Of course, only fresh nuts and only freshly chewed nuts, if we eat them, or freshly ground nuts, will have enough benefits. And
when should it be taken? In the first half of the day?
From the point of view of its stimulating effect, of course, it's better to take it in the first half of the day.
Gallstone disease is a contraindication. That is, if you already have stones, you should be cautious, but if there are only prerequisites and no stones yet, for example, if there is sludge or cholestasis, then on the contrary, you need to take it to prevent stones from forming.
In general, you should always drink coffee. Let's put it this way. You should always drink coffee. In any unclear situation, drink coffee. Because if we're talking about the gallbladder, basically the gallbladder only reacts to the fat contained in food. At the stomach's exit, where the duodenum begins, there's a receptor that detects fat, releases cholecystokinin, and triggers the gallbladder to contract. Only fat stimulates the gallbladder. So you can drink coffee even with gallstone disease, only with one small caveat: as long as it doesn't combine with excessive stress and an impulsive personality. Because for such a person, during an emotional outburst, not only coffee can affect the gallbladder, but really anything at all.
I understand. Many people also drink energy drinks and tonics, often in fancy cans, besides coffee. What is your general opinion about them, and how do they affect the gastrointestinal tract?
Ideologically, it's likely a substitution. But you can't call it a drug. But to some extent, we take external stimulation and, in a way, push it into ourselves. So it would be more correct to rely on the resources you have, rather than using any kind of doping, because any kind of doping leads to draining your reserves and possible breakdowns, though where this occurs can't always be predicted. But when it comes to energy drinks, the first risk that arises is, of course, the cardiovascular system and the nervous system. So maybe it's possible to use energy drinks once, but definitely not all the time. And again, what's the goal? If the goal is just to pull yourself together once, then probably that's not blameworthy. But if we start to abuse it, and abuse begins with regularity, if it's 2 times a week or 3 times a week, then that's probably the threshold when you should stop using energy drinks. And in addition, when we take an energy drink, we should have our own internal resources so that it activates our metabolism and releases energy from our reserves. If someone has no resources left, this stimulation will likely cause exhaustion and possible organ damage.
Energy drinks seem to give us energy, but really they just use our own resources. Everything has a cost. If you lack resources now, you'll pay the price later.
That's why you get situations where one person drinks an energy drink and feels some stimulation, more strength, while another person doesn't feel anything. He's already at 0, and the energy drink just pushes him into the negative.
My brother Tamur is a plastic surgeon who's always drinking coffee. I ask why, since it stopped energizing him long ago. He tells me he likes the taste. He drinks Red Bull in big cans too. I ask, why do you drink it? He just says he likes the taste. So many people don't drink it for the energy anymore, but just because they like the taste, we
live in a modern world. Now there are substitutes, flavor substitutes. For example, they take coffee or beans. First of all, they pack them in blister packs, and you can just chew on a coffee bean if you like the taste. Secondly, there are some coffee extracts that contain just the flavor compounds, and you can use those instead of drinking the whole beverage. Because basically coffee competes with calcium, and if we consume coffee and calcium at the same time or close together, we might be depriving ourselves of some nutrients. This applies not only to calcium but also to iron, certain vitamins and more.
Yes, tea and coffee also lower absorption. Zinc, for example. There's a lot of questions about fish right now. Well, people like to stir things up, saying you can't eat fish. You can't eat fish because it has a lot of mercury, especially tuna. And in general, they accumulate heavy metals. The attitude toward fish is that it's a filter for heavy metals because of that. It's not wild, it's usually farmed and artificially raised ocean fish. They are fed antibiotics and, pig waste. They absorb all of that. There's lead, mercury, and so on. Is that really true or not?
Ultimately, it likely depends on the producer's conscience. No more, no less. If we're talking about ocean fish, for example, then here we still have an idea about the content of elements in the ocean. And yet this fish is still subject to inspection. And the amount of nutrients and harmful substances in it is also checked for maximum allowable concentrations. That's why such fish definitely doesn't make it to the market. If we take fish that was raised in a hatchery, usually antibiotics are added there, some additional substances for feed, maybe certain hormones in one amount or another, but they usually don't contain heavy metals. And then such fish is also subject to control and checked for the content of heavy metals and certain substances, and only after that does it go on sale. Therefore, if the stages of production and control are carried out properly, then we don't have to worry about this fish.
I watched a video where there are huge dirty ponds that are just opaque or looking like a cesspool, and they put tilapia, a type of fish, in there. It cleans everything, making the water clear by removing excrement, dirt, and more. So here's the question: is all fish equally healthy? What are the top healthiest and most importantly most affordable fish for regular people? So what is the best? Salmon, maybe cod, maybe
Trout. Tuna, and pike perch, and the expensive pike.
Is the price of fish always equivalent to how healthy it is?
No, because today we mainly live in an economic world where production labor costs and marketing are the primary considerations. If well advertised, this fish's price will soar and its popularity will increase.
I was looking at tuna in the store, and there's even a label, especially if it's foreign, for the foreign market. They write wild-caught tuna, meaning tuna that was caught in the wild. And the farther from the shore it's caught, the healthier it's considered to be. Because all the harmful stuff, like mercury, it supposedly absorbs and catches less of it out there. I'm still figuring it out. Is it really worth paying extra for it? Because it really costs significantly more than the ones that are farmed or raised elsewhere.
Of course not.
So it's more about advertising?
because the costs of a fishing vessel trip are much higher if it sails farther. And here, by the way, there's nothing we can do, and it goes further. The shore isn't always clean since we've had many oil spills. Tankers don't break and spill oil close to shore. That's why the only guarantee is Rospotrebnadzor, which still conducts inspections, whether partial or full, and ensures our safety. But when it comes to heavy metals, fish probably isn't the most common source of heavy metals. There's much more of them in salt. And for example, the popular Himalayan salt, which is considered super healthy. It contains a lot of different trace elements, yes, including cadmium, including mercury, including lead, and everything else. All of these are trace elements, well, essentially from a chemical point of view. That's why we can truthfully claim this salt has many trace elements without listing them specifically. But this is the only salt that doesn't go through any purification and collects everything in itself.
We didn't lie, we didn't. The first step to health is to clearly understand what condition you're in right now. Do you have any problem that you don't know about yet? We usually get tests only after a problem appears, and some problems are already difficult to solve by then. It's very important to break things down into stages. Hiccups, where do they come from and how do you deal with them?
This is a very common question everyone asks. Probably. I assume it causes the most confusion, which is why it's asked more often. Although, in principle, from a medical point of view, hiccups are a fairly simple process. We have a diaphragm, the muscle that separates the chest from the abdomen, and if there is some kind of spasm of this diaphragm, well, a rather sharp or quick one, then it jerks and we hiccup. Usually, this happens most often when the stomach is overfilled. That is, when the stomach is overfilled, it pushes up and starts pressing on the diaphragm from below. And in response to this, in response to the overfilling of the stomach, it contracts and we hiccup. Or when some coarser, harder or larger food passes through the esophagus, or when eating dry food. That can also happen, causing irritation in the lower esophagus where the vagus nerve is, and it controls the esophagus, the stomach and the diaphragm, and this irritation causes stimulation of the diaphragm's contraction. It twitches and we hiccup.
And have you ever encountered pathological hiccups when, well, a person doesn't eat, there really aren't any reasons for it, but they've had hiccups for a week already, and they can't sleep, can't eat, can't sit normally, maybe they're hiccuping all the time?
Of course, that has happened. Sometimes a myocardial infarction causes hiccups, but they don't last a week. Fortunately, this is detected quickly enough, because there are other symptoms as well. This is fairly common with esophageal diseases such as esophageal candidiasis, where severe infection can cause erosive and ulcerative lesions in the middle and lower thirds of the esophagus. Hiccups also occur with esophagospasm. Usually there is some discomfort and pain syndrome of varying intensity, and at the same time hiccups appear. Sometimes lung diseases provoke hiccups because the lower parts of the lungs also come into contact with the diaphragm and can irritate it.
Intestines and immunity. Is the connection between our microbiota really that strong and significant? And our immunity?
We can't deny it. A fact is a fact. There are many microbes living there, probably about 2 kilograms, and in a day they stimulate the immune tissue of the intestine, the lymphoid tissue, Peyer's patches, so much that they produce several grams of immunoglobulin per day. That's why it's quite a large amount, and what happens next will depend on it. That's why people with intestinal issues like diarrhea, inflammation, irritable bowel, or excess microbes must involuntarily divert more of their immune system's resources to the gut. This also affects other organs and raises the risk of colds, rhinitis, bronchitis, and more.
What are the best ways to restore microflora?
Do nothing and just start eating. Because usually when the microflora is destroyed, we start taking active measures and begin taking a lot of probiotics. Or on the contrary, take a lot of antibiotics to increase the number of microbes. Or on the contrary, to reduce the number of microbes. But it's important to understand that in absolute numbers, most of the microbes are located in the lumen of the intestine, that is, inside this tube. And the main part of the truly functioning and necessary microflora is located in the parietal layer, in this very mucus and between the villi. And there, even against the background of intensive antibiotic treatment, these microbes remain in small numbers. They are sufficient to restore the whole intestinal microflora. The only thing is, you need to create the right conditions for this, because in poor conditions, of course, nothing grows, neither carrots, nor cabbage, nor microflora. And for this, first of all, you need to restore the intestines themselves so that their motility works and there is no irritation, and provide resources. Without resources, without fertilizers, no microflora will grow. After all, the main problem is that there are usually too many microbes, and in this situation we act in a paradoxical way. We add even more microbes from probiotics, and then there are even more of them. It's like if, for example, in this room, instead of 2 good people, there were 100. It would be crowded for us anyway, even if all these people are good, and then we would have to kick someone out. It's the same in the gut. If there is a certain number of microbes, there will be enough of them per unit area. Even if there are too many really good, super beneficial ones, it will still cause some discomfort or irritation in the gut. It may become inflamed depending on the species.
I read about a type of bacteria called Akkermansia. It lives exactly in the mucosal layer. And it really likes when episodes of fasting happen. When fasting begins, it doesn't eat food, so to speak, but eats the peptidoglycan layer and excretes what becomes a probiotic for the beneficial good flora. So it turns out that sometimes fasting can improve the flora.
Of course, that's a bit of a stretch. In general, it's called Mucifila Akkermansia mucifila. That is the one that loves mucus, and that's its downside. If it eats the mucus, there is less mucus in the intestine. Actually, our entire gastrointestinal tract is covered with mucus, and without it, it won't work. If it forms a large area where there is no mucus because it has eaten it, then the permeability in that area will be disrupted and irritation will occur. Because substances from the intestine will start to penetrate not through the mucus layer, but directly into the enterocytes in the intestinal cells, and the permeability between them will increase. This will lead to irritating substances entering the submucosa
Layer, and then
inflammation will occur. The real question concerns the scale of this process. But if we fast often and Akkermansia is still present, then sooner or later it will eat most of the mucous membrane, and this will lead to a problem. That's why there have been studies showing that if you actually do this, both fasting and having Akkermansia present, it can lead to weight gain and diabetes.
interesting.
But in general, fasting is of course a stress for the body.
We'll get to those questions. I'll definitely ask them. Why do people who quit smoking start to gain weight?
We chose the toughest questions.
I understand that they're probably just trying to keep their hands busy and end up eating.
But there are people whose metabolism actually seems to change in some way. There are 2 components. The first component is addiction, no matter how you look at it, whether it's psychological dependence, social dependence, codependence with family members or relatives, or dependence on nicotine, alcohol, or other drugs. It has psychological roots. And if we don't eliminate this factor, or at least balance it out, then one addiction will turn into another addiction. Whether it's a dependence on food, alcohol, or just something to keep your hands busy, in general, some kind of addiction will remain. That's why when a person quits smoking, psychological preparation is absolutely necessary in order to do it properly. The second point also concerns nicotinic acid and nicotine. They are mediators and neurotransmitters, and they also provide signaling between cells in the body. And that's why when we are trained for this process, well, that is, a long-term smoker constantly receives a certain amount of nicotine for a certain period of time. So, of course, there is a period of withdrawal and cleansing of the receptors from these substances. It usually lasts 4 to 8 weeks if we're talking about smoking. And this period can really be accompanied by weight gain, which is related to both the physical and psychological aspects. But nowadays, there are patches and pills that help overcome this.
Sorbents. Is it beneficial or harmful? Is there a line where we can use them, and can we actually harm the body with sorbents instead?
Paracelsus said the difference between medicine and poison is just a dose. But basically, we should consider any intervention as a kind of tool. With an enterosorbent, like a wrench or screwdriver, we can either fix or break something. Here, it all depends on the situation. For instance, if we treat issues like gas, intestinal bloating, or infectious diarrhea with enterosorbents, we do so purposefully. These substances remove, neutralize, and eliminate toxic, irritating, and harmful agents, which greatly helps. But if we're talking about a healthy person who just starts using enterosorbents, then we're clearly achieving something unclear. This unclear effect often causes us to lose protein, trace elements, and other substances. Washing out some microflora from the body leads only to negative effects.
There is no question about washing out the microflora on the lists. In America, I often saw such a popular service. They clean the intestines with a device that moves water back and forth, cleaning everything out. Then they give probiotics instead of antibiotics. In my opinion, they foolishly try to cleanse the body of toxins this way. Well, what do you think about this practice?
Definitely negative. First of all, we have this too, and it's also practiced here. It was known by different names: hydrocolon therapy and colon cleansing monitoring. Various rituals are added. Some use antibiotics, others probiotics. I once had a patient. They first used Narcan mineral water on her, then added about 200 grams of unknown probiotics. They ended with therapeutic mud, which meant we had to thoroughly clean her intestines afterward, because she ended up constipated for about 2 weeks. There's not much point in that. First of all, we talked about the fact that, of course, you can remove the luminal microflora, but the microflora that's actually in the mucus layer is the main one. And of course, it's not going anywhere because of this procedure, but by forcing a large volume of fluid in there, we risk washing the contents from the large intestine back into the small intestine, and in this way we are guaranteed to make the situation worse. Besides, usually before such procedures, no one bothers to do a colonoscopy and check.
What if there are diverticula or...
An ulcer forms when pressure causes a diverticulum or ulcer to rupture or leads to bleeding. That's why it's not safe. And if a person really wants to clean themselves out, there's that intuitive desire, right? Then they can use colonoscopy prep. Prepare, use the bathroom repeatedly, and you might even want a colonoscopy afterward.
I completely agree with you that this hydrocolonic therapy is poison for the intestines. Question: how does fiber work in the gastrointestinal tract? Many of our ancestors even considered fiber that is not digested as food. Explain to people why fiber is not digested and why it shouldn't be counted as a calorie. In general, you're not a cow, you shouldn't count it. Here.
It's a tricky point, of course. Well, let's put it this way. We have bile enzymes that help digest everything. Well, almost everything. Fats, proteins, and carbohydrates. There's amylase for carbohydrates, protease for proteins, lipase for fats. But for plant matter, for fiber, there are no enzymes. And that's why the most our body can do is provide a place for the microflora, which will do this work for us. So it's not our organs that will secrete enzymes to digest fiber, but the microflora will secrete enzymes to digest fiber and, in fact, consume this fiber as well. But you have to keep in mind that there are two types of fiber, soluble and insoluble. Here.
I'm insoluble, yes?
Insoluble. It's barely digested. And it should pass through, actually, it's kind of alien. We need it so that it passes through to form stool. Otherwise, there won't be any poop. Soluble fiber dissolves, so it won't help you go to the bathroom. Microbes will probably eat it. The microflora will develop, but whether it does so as we want is another matter. Nevertheless, anyone can just Google it more or less and find reliable tables that show the fiber content in foods. Insoluble fiber is usually recommended. And it's easy to calculate how much fiber you're getting from different foods, from vegetables, from fruits, from greens.
About fiber, there are jars of fiber that you can find in pharmacies. People buy them because, for example, they either can't afford to buy a lot of vegetables since vegetables are expensive, or they just don't like them. Is this truly an alternative, or is it still impossible to replace them? Fresh, healthy vegetables. Well,
by and large, they are an alternative, of course, because fiber supplements usually contain psyllium husk or psyllium. There are also other options available now. But nevertheless, even if it's not fiber from food or psyllium fiber, but some kind of inert synthetic carrier that simply creates bulk in the intestines, it will still work, and excess bile acids, toxic irritating substances, will still be released into it and removed from the body. And if there is no such carrier, then nothing will work. Well, as for preferences regarding fiber, I would add that many people actually avoid it because something starts to hurt. After all, many people would gladly eat fruits or some vegetables, but it's not about their taste preferences. But after eating them, they start to feel worse. They experience bloating, some heaviness in the stomach, or something happens with their stool. It gets looser or harder, so they avoid fiber. Eventually they get used to it and see it as normal. In reality, if a person can't eat fiber, it's a reason to check their intestines, treat them, and start eating fiber. And that's exactly the indicator. When a person didn't eat fiber, couldn't eat it, didn't like it, and in fact, when they started eating enough, they just started feeling bad. When he got examined and treated his intestines, after that he could allow himself to have more fiber. Without bloating, without gas, without unpleasant sensations, this actually confirms the effectiveness of the treatment in our situation even.
Tell me, what is your opinion on the use of baking soda and its effect on the gastrointestinal tract? There are people who like to drink hydrogen peroxide, and there are people who like to drink baking soda.
Yes, iodine is becoming popular, and some people also use potassium permanganate to cleanse themselves.
That's true.
Not really. For example, I can use potassium permanganate as an example. A man came to see me who, after a long hangover and drinking a lot of alcohol, decided to cleanse himself on the advice of his friends. Well, he had a headache in the morning, so he decided to take a lot of painkillers. Then he made himself a strong solution of potassium permanganate, really purple, and started drinking it to induce vomiting. As a result, he ended up with multiple stomach ulcers, his esophagus was completely burnt and brown in color, and his stomach was the same color because he basically did the whole combo. It was alcohol, it was a non-steroidal anti-inflammatory, and it was potassium permanganate. And constant self-induced vomiting, which increased the motility of the stomach that was already inflamed. So it's the same story with hydrogen peroxide. It's a very strong oxidizer. Women are familiar with this. If peroxide can bleach hair, which has dense covering tissue, then it can literally burn the mucous membrane of the esophagus or stomach almost instantly. Fortunately, it just doesn't have time to reach the intestines. Although coffee garlic enemas with peroxide were popular last year.
Question, what about alkalization itself? But not with methods like these, but for example with a proper diet, more vegetables, more fruits, more greens. That is to change acidity, to try to help the body, or rather to maintain its pH. Do you believe that you should try to consume more foods that will lead you toward alkalization? We mainly acidify ourselves, right?
Just last month I held a marathon about acidity. And there I encountered a huge number of myths, stereotypes, and prejudices on this topic. But mostly, most people don't understand the difference. This is a medical topic that's hard to understand without basic training. The body as a whole doesn't have any acidity. It exists in some specific local area. For example, blood acidity, bile acidity, for instance, stomach acid, urine acidity, saliva acidity, and what else? Cerebrospinal fluid acidity. And each place separately. Of course, it exists, and there are a huge number, specifically 4 buffer systems with incredible capacity, that maintain the constancy of this very pH. But if we eat normally on average, without abusing things like peroxide, hydrogen, baking soda, or anything else, then these buffer systems can handle it. Bicarbonate, phosphate, protein buffer system, hemoglobin. And if we provide enough resources for these systems, including bicarbonate, but not in the form of baking soda, of course, but in the form of certain foods, including phosphorus. Many people lack it and overlook it. While focusing on calcium and vitamin D, people often overlook the importance of phosphorus and protein. Usually, these buffer systems manage the process well. If we're discussing acidification or alkalization in a specific area, that's an issue for that area. If discussing urine alkalization, as a gastroenterologist, you'd refer this to a urologist, correct? It's typically due to kidney or bladder diseases. If we're talking about the alkalization of saliva, or in general the environment in the oral cavity, this is caused by the oral microflora, dental or throat diseases, and diseases of the salivary glands. If we're talking about stomach alkalization is caused by atrophies, which can eventually lead to cancer. This also affects intestinal pH levels.
For the kidneys, for example, I can say there are types of stones that form from uric acid, urates, yes, urates. To dissolve them, we give patients acid, basically, citric acid. There are such medications, effervescent tablets, they change the acidity of urine, and patients use test strips to measure the acidity. If they maintain the right range, the stone starts to dissolve.
In this case, we're discussing a disease, not a healthy person. This is important, as many healthy people try to change their acidity to improve themselves. And secondly, we're talking about a controlled change of pH in a local area, and it's done with monitoring. They use strips to measure it, but doing it blindly like many people do can cause problems.
Well, I believe that only in pathological conditions does the pH of blood or environments change radically in one direction or another. But for some reason, people think that if they eat a lot of fast food, their blood pH starts to decrease or increase depending on their diet. In fact, unless we're talking about some critical condition, pH is always stable. But the effort your body will have to make to maintain it will depend on how you eat. If you naturally put junk in your body, it'll make things harder for it. You'll lose calcium as it's released and starts leaching from the bone. That's why pH is always stable, unless it's a semi-critical condition. I have an interesting question about the stomach. People always say, I have high acidity, I have low acidity, and they get confused.
Excuse me, let me add something about the semi-resuscitation states. We remember from physiology that blood pH is 7.35 to 7.45. A shift in either direction is called either alkalosis or acidosis, and there are different types by origin, such as respiratory or metabolic. Therefore, with certain internal organ diseases, a metabolic shift is possible, including a shift towards acidosis, due to the production of a large amount of ketone bodies. And many people deliberately try to push themselves into ketosis and strain their buffer systems on a diet, especially on a keto diet, in order to get some kind of wow effect from it. But regarding the keto diet, first of all, it can be dangerous if you actually push yourself into metabolic acidosis or alkalosis. And secondly, this only applied to situations with diseases. For example, diabetes mellitus. If someone has a disorder, taking the opposite dietary action is acceptable with a doctor's supervision and careful monitoring of blood sugar and ketones. But on your own, of course, you absolutely must not do it.
There are even supplements that help you enter ketosis, meaning a person doesn't enter it right away. Usually it takes a few days, sometimes a week. You can kind of fall out of it. They monitor it. There are sports supplements that boost your diet's ketogenic effect. Well, about ketosis, it's clear. I also agree with what you said here.
The main thing is not to overdo ketosis.
I wish everyone great health. Increased and decreased acidity. How and why do people confuse them? Is it really a question of the concentration and volume of acid? There's a problem with both the acid's volume and concentration. How are these issues fundamentally different?
There's also a pH issue. I explained this in my book Stomach Wars. I'll read it now. Well, look, the volume and concentration. For example, we have a glass of water. If we put 10 grams of acid in there, the amount of acid will be 10 grams. If we pour in more water, the amount of acid will still be 10 grams. But if we put 100 grams of acid in there, then there will be more acid. We are interested in this in the context of how the stomach works. The stomach secretes acid according to the signals it receives, signals from receptors in the nose, mouth, eyes, from expectations, and from food. The stomach produces the needed acid for digestion based on how much food is present. Suppose a plate of food needs 10 grams of acid. Whether we dilute it in a liter of water or in half a liter of water, it doesn't matter for the digestive process. And actually, if there's more liquid, the food will mix faster, reach a softer consistency more quickly, and leave the stomach sooner to continue the digestive process. So here, if we take 10 grams of dry acid and mix it with 200 grams of regular food, no digestion will occur. That's why the volume is important here. The amount of liquid and the amount of acid matter. There should be a certain volume of liquid, and the amount of acid released depends on how much we've eaten. But the pH scale adds extra confusion here because in terms of acidity, it basically works in the opposite direction. We count from 1 to 14, where 7 is a neutral environment, and then it turns out that if we take a more acidic environment, the pH becomes lower and the acidity is higher, the amount of acid is greater, and the number is lower. And this discrepancy confuses everyone. And then, when the amount of acid becomes less, the pH becomes higher. That is, there's less acid, but the number goes up, and everyone interprets it differently. Some people say that when the acidity increases, the number actually becomes smaller. This is where confusion starts. As the number decreases, acidity rises. This always confuses people. That's why it's better to use simpler concepts. The closer the number is to 1, the more acid there is. When the number is closer to 7, there's less acid. And that's what interests us. Because if the stomach really starts producing less acid, that's already a severe degree of atrophy. According to biopsy, this usually matches operative link on gastritis assessment stages 3 and 4, when stomach cancer risk rises 21-fold, and cancer can develop within 2-3 years.
I forgot to ask a question about the gastrointestinal tract and the skin. There is such a belief. Recently, I even had a friend who was on Roaccutane. He started at 18 and no one could help him. And we were only able to get him off it when we fixed it for him. It's about microflora, but whenever he breaks his diet, he ruins it. If a person's nutrition is important, then we strictly determine his diet. He has weak dry acid, Borrelia and E.
How he says goodbye to the guys in scientific multisome therapics. Intestinal microflora is vital for regulating immune strength and response. That's why immune-related changes can occur on the skin, in the joints, and other autoimmune diseases may develop. Such associations, known as overlap syndrome, also exist here. So, what's the right way to see a dermatologist? Well, we're discussing this from the patient's point of view, right? If you have skin problems, you should see a dermatologist and get an exact, clear name for it, meaning a diagnosis. What is this skin problem called? You should see a gastroenterologist to get a clear diagnosis for your intestinal issue. And then it becomes clear whether there is a guaranteed connection. A definite link exists between inflammatory bowel diseases and conditions like atopic diseases, certain infectious skin diseases, and immune skin diseases. And this situation is guaranteed. There are cases when there is an absolutely guaranteed absence of connection. For example, we have a bowel disease that does not involve the immune mechanism in any way, and a skin disease that, let's say, is related to female sex hormones. Well, or, for example, acne. That's it. In that case, there is definitely no connection, and then we clearly understand that the bowel needs to be treated separately and the skin separately. But in most cases, from a practical standpoint, as often happens in life, there is... Existing skin conditions often worsen when bowel function is disrupted. And this really does often happen, and we see this in people who start restoring the gut microbiota or start working on having regular bowel movements or basically begin treating their intestines. Then the skin condition improves. Well, in this way, we're only eliminating the trigger, not actually finding the real connection.
I've loved spicy food since childhood. Sometimes my friends and I even have challenges to see who can eat the spiciest food without showing any reaction. How harmful is spicy food in general, or is it actually beneficial? And is there really a connection between gastritis and spicy food or not?
To answer that, you just need to look at the global map of disease rates, where gastritis, reflux, ulcers, and all those other upper digestive system diseases are most common. And we see two bright large spots, India and Mexico. And that's exactly where they really love spicy food. Yes, it's related to cultural traditions there, and maybe for the gut that's not so bad. In the absence of antibiotics and proper sanitation and hygiene, they somehow manage to cope. By adding an excessive amount, spicy food helps prevent excessive bacterial growth in the intestines. But overdoing it isn't very good either, because we disrupt the motility of the stomach, the motility of the esophagus, and the motility of the intestines. All this results in faster transit, and in some cases worsens hemorrhoids, and then as the next stage, if this happens regularly, the disrupted motility leads to disease. Plus, spicy food increases the permeability of the mucous membrane, and it becomes more prone to other irritation, inflammation, or infection.
Regarding hiccups, as we basically discussed, that's why we start hiccuping from spicy food, because it irritates the esophagus. A question about parasites. Right now, this is a real problem for many supplement sellers. They claim everyone has parasites and say, no need to get tested, just take these pills to get rid of them. The question is, are there any signs if a person has parasites? And, well, if there aren't any obvious signs, for example, how can you get checked? For example, there are pets or there are some symptoms that a person found online, or maybe he has a phobia. So to understand that there's really nothing wrong and to calm down, what should he check first?
She took a risk.
Just a test for worm eggs.
There's a standard stool test. Basically, it's an effective method. I feel sorry for the lab diagnostic doctors since they'll have to handle this biomaterial. Apply it to a microscope slide and sit in a fume hood examining this biomaterial for at least 10 minutes. Of course, without a mask, and even if they're wearing a mask, it doesn't protect against the smell. Look for these worm eggs there. There are plenty, so you'll definitely find some. You can identify the specific parasite and its location just by its appearance. But here the human factor plays a role. So a more modern method, which also involves the human factor, is the Parasep method. That is a special technology that allows you to see parasites more accurately in a stool analysis. And if you submit it for 3 days in a row, it is usually enough to detect parasites. After all, any parasite we take as an example. For example, Ascaris releases 200,000 eggs daily, making it impossible to miss them in a stool analysis. Besides, well, I was lucky. I studied at the People's Friendship University and saw a lot of parasites. They are quite large. Actually,
that sounds impressive.
Yes, if we take Ascaris, it's about 25 centimeters. Any examination can detect it. Any imaging today can detect something of that size. Even if we take the small liver fluke, its size is 1.5 centimeters. An ultrasound can easily detect objects as small as 1.5 centimeters, even fractions of a millimeter.
And what are the symptoms?
Yeah, well, we kind of started with the examinations. So, if our goal is to find worms, first we can do a stool test, and second we can try to figure out where the parasite is and see it with any instrumental examination. There are no specific symptoms, unfortunately. There aren't any special signs. They're more general. Usually, now I'll tell you how to answer this question well. Because if we remember, they don't live alone. And since they release a huge number of eggs, a person doesn't swallow just one egg. He swallows a dozen, or 2 dozen, or 100. And from that amount, of course, quite a large number of worms hatch. That's why it's rare for a person to have just one parasite. Usually, there are about 20 of them, 30 of them, so quite a lot. Such a number of fairly large foreign bodies, and these are foreign bodies, and the immune system reacts to them as foreign bodies. It causes a very strong decline in well-being, as well as fatigue, tiredness, irritability, and real intoxication. Because if a healthy worm like that causes trouble, it will affect everyone. Sometimes this is even accompanied by a fever, but the immune system is definitely involved. That's why allergic reactions are the first to get worse. If someone had atopic dermatitis, bronchial asthma, or allergic rhinitis, all of that flares up instantly. As soon as the parasite appears, Galit 2. Next, depending on where this parasite ends up, some local symptoms may be added to the general ones. For example, someone visited Thailand, where there are many filariae. They live in water, penetrate the skin, and parasitize the venous system. And then diseases of the veins in the lower limbs usually begin. And then all the symptoms will be there. If these are worms that we have ingested, then all the symptoms will be related to the digestive system. And there aren't that many symptoms, and they're common: heartburn, bloating, some mild pain somewhere, and irregular bowel movements. If these are other types of worms, such as those parasitizing the skin or subcutaneous tissue, the affected area will hurt. For example, one of my acquaintances got a shepherd dog and it had worms, and accordingly, these worms can enter a person as an intermediate stage. And they want someone to eat it, but in our case, no one eats a person. That's clear, that's...
A cyst? Yes, according to...
I think it's called that, yes. They're in a certain place, usually somewhere in the muscle. You really have to look for them. They found his under the shoulder blade, in the muscles, under the shoulder blade. Not long ago, there were big outbreaks of trichinosis when this parasite is found in the muscles. By eating raw pork or poorly processed pork, you can get this disease, again, if the meat hasn't been inspected. And then, certain joint or muscle pains can indicate the presence of parasites. So, in the end, it all comes down to the specific location. We once had an African American patient who had a parasite in his pupil, in his eyeball, and from time to time, he would lose his vision. At a random lucky moment, just after losing his vision, he was taken to the ophthalmologist, who then discovered the parasite. according to...
I think I know one, Loa, I think it's called, right? Yes, that's the one.
There. So anyway, let's get back to life. We rarely encounter such refined worms in our lives. No, let's take the fish we talked about, or the beef that's raised somewhere. They no longer roam or graze in the fields where they could pick up worms. Because in the stall where they hardly ever go out, well, they eat prepared feed, there's no chance and no risk of getting worms. Even if we're talking about bodies of water, there are no longer those big pond snails and mollusks that could serve as intermediate hosts for these parasites. That's why the life cycle chain of worms is broken in most cases, and that's why our chances of actually getting worms are very low, extremely low. And even more so, on one hand we talk about how meat is packed with antibiotics and hormones, but on the other hand, how could parasites survive in such meat?
You know, there are a lot of detox programs and cleanses, and I never really understood one thing. For some reason, everything is focused on the gastrointestinal tract, although in fact we eliminate waste products and byproducts through our skin and urine as well. Why is there such a focus in these detox programs specifically on the gastrointestinal tract, on enemas, on supplements that we put into our gastrointestinal tract? Is this the right approach, or should cleansing be more thorough?
And secondly, what is your opinion on detox programs? It depends on what meaning is put into a detox program. Because if it's about rest and some improvement in lifestyle, then why not? For a person to go as an alternative to a vacation, getting some fresh air, gaining proper knowledge about nutrition, doing some physical activity, and not overeating in general will have a positive effect on anyone. But maybe it's not right to overpay for that. On the other hand, sometimes people take advantage of this and add some extra procedures that create a feeling of relief, and we directly associate relief with defecation. No one ever felt relieved while urinating, but only in cases when a person has held it in for a long time. Charlatans and fraudsters often use quick, visible results to show them immediately. For example, we use a laxative, quick relief, instant. You don't need suppositories as a laxative. Certain foods can work instead. And the person he lost about 1.5 kilograms of contents that he had eaten over the past day, and he felt light and good. This effect impresses many people, making them feel lighter, about 1.5 kilograms less. But you don't get this effect with diuretics, because here it doesn't feel like it's not perceived as a miracle. If we sweat, that's also not always perceived as a miracle. Although you can also remove a lot of substances from the body through sweat, but that's just perceived as a kind of sauna. That's probably why detox through the gastrointestinal tract is becoming popular. And besides, the incidence of gastrointestinal diseases is very high. And that's why, if we take a person who has even minor problems in the gastrointestinal tract, if he starts eating better, going to the bathroom more regularly, and generally moving more, he really does experience improvement. It's important to note this is only a temporary improvement. Fully curing the problem would be better. And not need detox every 6 months, just to feel good.
Bloating is a major issue for some people. I understand that you can't just give one piece of advice like don't drink milk and you won't have bloating. There are many causes, and depending on the cause, bloating is treated differently. Tell me, how can you figure out what's causing the bloating?
We have 3 options when it comes to bloating. The first is when there is actually a serious intestinal disease, but the person doesn't know or realize it. For example, many people since childhood don't go to the bathroom every day, but go once every 3 to 4 days, and some even go to the bathroom just once a week. And then, over time, the condition of the intestines starts to get worse, and bloating really does appear, but they don't even suspect it. Their life has always been this way, so since childhood they've used the bathroom like this and believe it's normal. Of course, this situation needs to be treated. Some people frequently use the bathroom or have stomach pain, which can be caused by a serious intestinal disease that leads to bloating and needs treatment. Then we look at other symptoms, whether they are present or not. For example, constipation, loose stools, or diarrhea, or any kind of abdominal pain in any location. If they are combined with bloating, then that's the first sign to check the intestines and treat them. Another story is quite the opposite. For example, it's a skinny girl who has has some dietary restrictions. She tries to watch her weight, and when she starts eating a bit more because she's skinny, her stomach sticks out. And many people see this as bloating, although it's just because of her constitution or body type that what she eats becomes noticeable. Most people occasionally experience this bloating, not as a result of illness, not as a result of being fixated on appearance, but as a result of a situational dietary mistake.
We may call this condition crudely, but do our Armenian brothers have any comments?
Periodic disease? Yes.
We sometimes call it Armenian disease. The stomach swells like a drum, then suddenly goes back to normal.
But there is a real periodic disease, which is genetically determined and is truly a rare condition. Both Armenians and Jews are affected here. It is observed more often in them. We sometimes joke about a periodic disease when a symptom shows up just once a week, for example. Yes. That's it. And in this case, we use a stool test. It's best to get a general stool analysis, an occult blood test, and colprotectin to check for intestinal issues. If these tests are negative, then we can talk about situational overeating or a situational dietary error. In this situation, you actually need to begin. Eat those foods that cause gas and bloating, but in small amounts as a delicacy. This way, we adapt our microflora.
And
the types and species of microflora that digest this product better begin to grow. And over time, this bloating goes away.
Question. There is such a thing as irritable bowel, but there is also such a thing as inflamed bowel. What is the fundamental difference between them?
Neurogenic excitability of the intestine exists and has its own code in the International Classification of Diseases. When we talk about an inflamed intestine, the intestinal cells die, they are destroyed, and sooner or later, this leads to severe inflammation, for example, to the formation of defects in the intestine and bleeding. Is this an immediate risk, or is it cancer due to the constant regeneration of the intestine? If we consider intestinal irritation as a process rather than a diagnosis, it's a vicious cycle involving impaired motility and disrupted microflora. The reaction of excessive nerve endings, permeability, gas formation, and much more. This vicious cycle is closed and only the functioning of the intestine as a process is disrupted. If it lasts for a long time, it can also lead to inflammation. The key is not to miss the moment, since people often live with irritation for a long time, leading to inflammation and cell death. With irritation, the intestine just functions wrong, but no one dies, and there are no victims. Subtitles. But neurogenic excitability of the intestine is a reaction to stress, a disruption of adaptation to some social situation. And then indeed the intestine may occasionally malfunction. That is, it's not a constantly existing condition, but one that occurs periodically. What is called Bear disease, which many students are familiar with.
And when does it need to be treated, and when does it not need to be treated? Always. It needs to be treated.
Always.
And if, let's say, he's comfortable living with it, then it just is what it is. Or is this a question about the consequences, what it could lead to?
From a health standpoint, it's about the consequences. Chronic irritation causes inflammation in about 40% of cases. I'm not sure of the exact figure. If left untreated, inflammation can eventually cause cancer. So it's best to treat it properly for your health. If someone claims it doesn't affect their daily life, I doubt they're being fully honest. Because if you can't clearly plan when you'll go to the bathroom and it catches you off guard in an unexpected situation, then living with that is really difficult. Or if someone is suffering, unsure if they'll have gas, or not have gas at any given moment in a social situation, that also, of course, is distressing.
Visceral massage, also known as intestinal massage. Does it exist? And if it does, what is your opinion about it? And who is it recommended for?
For young children, when a mother rubs their tummy and reassures them, it probably helps. Mechanical stimulation can mildly trigger peristalsis, helping children have less gas and improve bowel movements, but nothing more. Those attempts at deep visceral massage that are done in hopes of changing the position of organs or something else are, at the very least, doomed to failure. And the effect from them is the same as when mom rubs your tummy. Just a slight redistribution of gas in the intestines and nothing more. Actually, we can recall anatomy, but our viewer probably can't. But all the organs are in the abdominal cavity. They are still located in the mesentery and are quite well fixed in those places. When they are inside the mesentery, go under the mesentery and are in a retroperitoneal position. Therefore, it's impossible to actually move the organs, and this idea to do visceral massage to put the organs back in place is, of course, an absolute lie. Another thing is that I do this every day during appointments when I examine the abdomen, and constantly during the examination I have to move an organ from one position to another, because every organ, except maybe the kidneys, intestines, and stomach, there is a certain amount of play within 2 or 3 centimeters, but this play changes with body position, when bending over, and in any other situation.
The kidneys too. If the fat capsule is depleted, meaning the girl has lost a lot of weight and the fat is gone. This is one of the main supporting structures of the kidney. The kidney can start to sag. This is called nephroptosis. And there can be problems, especially when they lose a lot of weight. And then, because the kidney starts to sag when standing, all that holds it in place is the vascular component, that is, the vein, the artery, and the muscles. Because of this, problems can occur. The outflow from the kidney is disrupted and blood circulation in the kidney worsens. We perform surgery because after weight gain, the fat doesn't return and the kidney often stays displaced. And we fix the kidney and we attach a special synthetic sling to the lumbar muscle with a stapler, and we place the kidney in the sling like a hammock and attach it to the kidney. Sometimes we surgically fix the kidney due to problems. For intestines, I operate myself and see it's impossible to move them. You struggle, but they stay where they are. The large intestine is stationary, but the small intestine moves freely. You can only move it with your hand, and if you move it there, it will move the same way when you lie on your right side.
And that's why there are a lot of these pseudo-explanations when people say you have gastroptosis, your stomach has dropped, or you have colaptosis, your intestine has shifted somewhere. In general, when the digestive organs are healthy, their position doesn't matter. If the stomach is lowered but there is no ulcer, it will function normally. Whether it's in its normal position or lowered, if there's an ulcer, the main issue is the ulcer.
Recommendations for patients with colitis. I have a friend, I'll probably ask you to talk to him later, he's a very good friend of mine. And he started having frequent flare-ups, for example, when he tried to quit smoking. He was in Germany and the doctor there told him, don't quit smoking, keep smoking, the flare-ups will be less frequent. And his colitis always gets worse when he's stressed. How should they eat in general? And maybe you have some recommendations for such patients, how to make their lives easier?
There are some. When examining a situation, many details and nuances arise, since there are different types of colitis. For example, there can be a simple colitis that is the result of some kind of damage that has already happened, and after that, nothing else is supporting it. Crohn's disease involves flare-ups, requiring you to manage both the flare-ups and the overall condition. There are ulcerative, collagenous, lymphocytic, granulomatous, and eosinophilic types of colitis. There are several options, each with specific limitations. Shorten and rephrase the text by up to 23%. Keep all names and locations. Maintain the speaker's perspective. Do not add or infer information. Ensure correct and United States grammar. Shortened text. If we're discussing intestinal inflammation, it's key to know that proteins, fats, and carbohydrates are mainly absorbed in the upper intestines and usually don't reach the large intestine. And the main factor becomes either an excess of sugar that doesn't have time to be absorbed in the upper sections. But we're really talking about an excess here. It reaches the large intestine, promotes microflora growth, causes bloating, gas, and inflammation. Excess bile acids also end up there. If we eat little fatty food, that's why we need to eat more fatty food in this situation. And fiber also ends up there, and the amount of fiber will actually matter. If we eat enough fiber, our bowel movements will be normal and we'll feel fine. If we eat an excessive amount or a large amount of soluble fiber, then again we'll get bloated and have diarrhea. And if we completely eliminate fiber, then there won't be any bowel movements. But for people with inflammation in the intestines, sometimes the inflammation actually helps them out. But that's a cruel joke that it plays. For example, a healthy adult needs 25 1 ounce of fiber per day. If they don't eat that, they get constipated. And if a person has inflammation in their intestines, they can afford to eat, not 25 but 5 or 10 grams of fiber. With inflammation, the intestines work quickly, so everything moves too fast and gets carried out, making stools appear normal. Returning to a normal fiber intake could mean going to the bathroom 6 times a day. By masking symptoms, we don't realize how severe intestinal issues really are.
Does the stomach age?
No.
The same, even if...
At 20...
Even at 60
years old, it's the same. And that's probably the digestive system, along with what else? What regenerates well in our body? Liver?
Liver, yes, well, that's...
It's also part of the digestive system. People mainly know it can regenerate. The gastrointestinal tract, including the esophagus, stomach, and intestines, also recovers easily and quickly. And for example, if a person has an ulcer, we can absolutely treat it in 21 days without any problem. And everything will be like new, everything will be absolutely new, not even a scar will remain. If we did this properly, in 21 days dragging it out could cause consequences. But the pancreas does not regenerate, unfortunately.
The kidneys don't either, and...
The kidneys don't either, and the gallbladder doesn't regenerate either. But in principle, if an organ regenerates, then by eliminating all the causes that damage it, it returns to its original state and will feel absolutely fine.
Are there situations when antibiotic damage to microflora can't be reversed?
As for the microflora itself, no. But the fact that colitis develops against this background,
The same one, for example.
the same colitis or candidiasis, which often occurs and can lead to disseminated candidiasis. And that's a terrible situation. Or, for example, clostridial colitis, when clostridia settle in the intestines during antibiotic therapy. And they can cause such a serious recurrent or therapy-resistant...
Difficile, I think, yes.
Yes, Clostridium difficile. Difficult to treat colitis.
It's just that my mom is a coloproctologist.
That's wonderful. Well, let's be objective. There are, for example, severe forms of the disease. Crohn's, yes, and fulminant colitis, where the intestine can tear apart in just a few days.
They swell up to such enormous sizes, yes, and...
It's called toxic megacolon. When the right side of the intestine fills the entire abdominal cavity, it happens. But, as always, mild cases are much more common in life, and truly severe ones are rather rare exceptions. And in such situations, people are hospitalized, and there they have access to reserve medications, heavy artillery, and, for example, biological therapy and some additional options. And in most cases, it's possible to save these people.
Is it possible to restore microflora without using probiotics? Well, if there are serious damages, or if it's really serious, do you already need to take something?
Probiotics don't restore microflora. Because there were studies with labeled isotopes, and they checked that the maximum we can get from these bacteria stays in the intestines for up to 4 days. After that, it gets diluted or eliminated from the body. Different species have different paths, but in general, these microbes that we try to introduce don't take root. They can only give an impulse, a stimulating effect, and improve the development of your own microflora. Nothing more, nothing less.
Are there any supplements that can help restore the flora? Not bacteria, but specifically supplements.
You need to feed it.
Feed it? But what do I feed it? Pectin, agar, yes.
Everything. So if our goal is to restore, we use different nutrient media, different types of fiber, various fermented foods, and we add them in tasting amounts, gradually introducing them into the diet, and then the microflora is restored.
There must be something that should definitely be eliminated. For example, alcohol. I have a question. Does alcohol affect it? And how do you generally assess the effect of alcohol on the gastrointestinal tract?
Well, we've already talked about processed foods. They definitely need to be eliminated because they increase both the risk of inflammation and the risk of cancer in the intestines. As for alcohol, our microflora synthesizes about 1.5 to 2.5 grams per day. So it's a byproduct of its activity and it's adapted to it. But we also know about alcohol that its absorption area is the duodenum and the lower part of the stomach. So for the most part, it doesn't even reach the small intestine, just like it doesn't reach the large intestine. And it doesn't really have much effect on the microflora. The toxic metabolites of alcohol, which are released by the liver, along with bile, have an effect. Their influence is possible. But some of these metabolites are also excreted in the urine, so it's possible that a larger amount of fluid reduces the toxic effect on the intestines. Nevertheless, we cannot endorse alcohol, but specifically things that contain yeast. For example, beer or cider, which is also made with yeast. They can disrupt microflora and trigger fermentation and inflammation in the intestines.
Bad breath is often a sign of problems with the gastrointestinal tract. That is, unless we're talking about someone who, for example, has a decayed tooth or some kind of coating on the tongue. Can you give some examples of things patients might notice on their tongue, on their palate, or maybe some kind of smell they might detect, and what these could be related to? A few such examples.
Yes.
So that suddenly someone recognizes themselves and says, oh,
let me give everyone something to think about then. So sometimes we have bad breath and sometimes we have a taste in our mouth. And when you observe yourself, it's very hard to tell the difference. And that's why we should remember that we only have 4 tastes: bitter, sweet, sour, and salty. We don't have any other tastes. And sometimes we confuse a certain taste in the mouth with bad breath. Besides that, sometimes we have a smell in our nose. We usually detect smells with our nose, not our mouth, because receptors in the upper nasal passage sense them. That's why bad breath probably has to be strong enough to reach the nose as well. And that's the main trick, to distinguish between bad breath, a smell from the nose, and a taste. There are also strong psychological traps when someone can't detect the smell themselves, but others can. And here you need to double check every time whether the smell is really there or not, and someone from your family or relatives should help you determine if the smell exists. But the first obvious thing is of course the coating on the tongue. If there is a coating on the tongue, it is likely the cause of the smell. Dentists recommend cleaning the tongue in this case, but gastroenterologists advise against it.
By the way, I wanted to ask.
Because nowadays there are such crazy scrapers that with enough effort can scrape off the top layer of epithelium from the tongue. And this creates a foundation or a precondition for both microflora to grow there, inflammation to occur, and for odor to appear.
We remove the protective layer and everything thrives.
It grows, and we constantly injure the tongue. So, if we were removing the protective layer, say from the cheek or the palm, then of course there would be abrasions here, and constant injury would lead to problems. So, if there is a coating, you shouldn't clean it off. You should first take a swab from there. And then it becomes clear what caused it and where the source of the infection is that's creating the coating on the tongue, whether it's fungi, bacteria, microflora, or some other option, because microscopy shows if there are fungi, microbes, or some pathological cells present, and this is easily determined. But if we're talking about the gastrointestinal tract, then there can be 2 sources. Either it's the stomach itself, when a person can't keep the valve between the esophagus and stomach closed at all, not even a little. He can lean over and it will pour out, making the stomach smell noticeable when exhaling. This is very rare.
This is a coat of arms, yes?
Yes, this is a very severe form, a coat of arms. Such cases are rare. More often, gut odors are due to intestinal microflora, which works by a completely different mechanism. The gases produced by the microflora are absorbed into the blood and exhaled with the air. Then we adjust the condition of the microflora and the smell disappears. Indeed, that's possible.
How many times a day should you eat? It used to be trendy to eat almost every 2 to 3 hours. Now they say it's healthy. Eating 2 to 3 times a day is considered unhealthy, meaning it's not healthy to eat every 3 hours from a container. What do you personally think is the right way to eat? I know it depends on the goal, but if someone isn't aiming to maintain or gain muscle mass, just to be balanced, to stay healthy and look and feel good, simply eat properly and maintain a balanced diet. He doesn't set any athletic goals for himself.
If we're talking about more or less balanced nutrition, then first and foremost, it's about the amount of food, more or less. The average caloric value of regular food is about 120-140 kilocalories. We factor in small dietary deviations, and we end up with roughly 1.5 kilograms of food. 1.5 kilo of food is split into 3 500g meals. But usually that's a bit too much, so it's better to split this amount into 4, for example, meals or 5 meals. The main thing in this situation is to set aside time for yourself to eat calmly, without
the television.
And in general, you need to be ready for a meal, because usually you should feel hungry first and then eat. But in life, we often get caught up, get overwhelmed, and miss that feeling of hunger, or we just start eating by the clock. You should regain those feelings, but don't depend on them blindly. For example, with some illnesses like atrophy or stomach ulcers, hunger can disappear completely. So you need to feel whether you are hungry or not. If you are, then you can basically eat according to your hunger. If you're not, that's a reason to check your stomach.
Sergey Sergeyevich, I have a question about food. They say you should leave the table still a little bit hungry. Is that true?
Well, maybe just not completely stuffed.
Well, in other words, don't overeat.
Don't overeat.
But drink. We were talking about gastric juice. I indirectly understand that you support the idea that it's okay to drink, basically, during meals, and
it's better not to overthink this topic. Because let's say we produce a certain amount of gastric juice for a certain amount of food. The body won't produce more than that. It might produce less if you're sick, but it won't produce more. So what the stomach produces is definitely enough to digest this food. If we do this dry, it will take longer, because the stomach will have to mash this dry food, mix it with dry gastric juice, and this will take a long time and create increased mechanical stress on the stomach. Therefore, you can add some amount of liquid, then the mixing will happen faster, the consistency will quickly become soft, and this will only speed up the digestion process, and there will definitely be enough acid.
Helicobacter, should it always be treated if it's detected or not always? The person has no complaints, he doesn't have erosive gastritis, they did a gastroscopy and took a test for Helicobacter.
That's the problem, he doesn't have any symptoms. It's like how hepatitis C was called the gentle killer. There are no symptoms, but the virus slowly damages the liver, causing cirrhosis, liver failure, and cancer. And Helicobacter is the same story. It slowly, gradually causes atrophy in the stomach. Atrophy doesn't hurt, there are no unpleasant sensations, but then comes metaplasia, dysplasia, and cancer. Today in our country, 39,000 cases of stomach cancer are detected, most of which are at stage 4. Subtitles. People didn't notice symptoms, monitor their stomach, or treat Helicobacter, leading to this situation. Among them, 90% have Helicobacter.
As an oncologist, I confirm that cancer is often detected at late stages with metastases and carcinomatosis, when we usually can't cure, but only help, improving quality of life and prolonging it, not recovery. So yes, that's how it is.
Recently, we hosted a series of events for doctors with Hertzen endoscopists. Even with modern endoscopy at 70x magnification, you can see Helicobacter damage. All international guidelines are based on research and show that Helicobacter causes this problem. Only the Japanese are doing everything correctly today, and they've reduced stomach cancer rates. This therapy eliminates Helicobacter. That's why the sooner you get rid of it, the healthier your stomach will be. By eliminating the cause and fully curing atrophy and metaplasia, the risk of stomach cancer becomes 0.
How do nerves affect the gastrointestinal tract? Alright, well, I'm not talking about those cases when you got scared, got nervous, and you feel nauseous or you vomit, so to speak. Basically, I'm interested in chronic stress, not acute stress, but the state of chronic stress, because they say that stress causes ulcers, stress leads to gastritis, and stress causes constant bloating.
We should add more detail about stress since it varies. For example, it can be a panic attack, depression, anxiety disorder, or other conditions. But one of my teachers, Peter Molfertainer, conducted research specifically on stomach ulcers and the influence of depression and anxiety disorder. The longer the experience, the higher the risk of ulcer disease. There is a direct connection. This is carried out through the nervous mechanism of regulation and control of the stomach, the gallbladder, the pancreas, and the intestines. Only the liver is not affected by stress. Well, only in cases when stress leads to binge drinking. That's it. Initially, motility is disrupted, causing it to speed up, slow down, or become chaotic anywhere in the digestive system. Additionally, secretion is disrupted, meaning that part cannot properly release substances like stomach acid, bile, or pancreatic enzymes. At the moment, this is disrupted, and these small but constantly existing disturbances actually lead to a more serious problem. For a disease to develop, a certain prolonged period of stress is needed. Well, the time frame is about 6 months to 5 years for a disease to develop.
Poisoning. Can you explain what happens when a person gets poisoned? We have diarrhea, feel sick, and are nauseous. What's happening in the intestines and why? Is the body flushing out toxins, or are these effects from the toxins? But what are the first steps to take? So what's the gold standard for dealing with poisoning? If someone ate something and started feeling bad, what should they do?
Of course, the body tries to evacuate it. Since toxic substances affect receptors in the stomach or intestines, wherever they end up, the body expels everything.
Sorry to interrupt you, Dika. A lot of subscribers make one very big mistake, in my opinion. When they get food poisoning, they take antidiarrheal medications. But what do you think? Can this make the problem worse? Since the body can't expel waste, the intestines become blocked and everything remains inside.
Absolutely. It's clearly stated in the medical instructions. Because instead, all this damaging force can be evenly spread throughout the entire gastrointestinal tract, and then it won't cause severe damage. When we stop, all of this stays in a local area and causes more severe local damage there, up to an ulcer or a ruptured blood vessel. It's prohibited, as shown even in the medical usage instructions. But since these kinds of food-related episodes can happen, there are 3 types. There can be toxic exposure, when a harmful substance gets in. It can be viral, or it can be bacterial. If it's toxic poisoning or a toxic food episode, we won't accomplish much with this kind of stop. But if there are bacteria or viruses, then of course the local damage can be very serious. They will multiply in that area and cause serious damage to the mucous membrane. That's why the first thing we need to do is not interfere with the body. If the natural reaction works and you're vomiting well, it means you need to get rid of that content from above. If diarrhea occurs, you need to get rid of that content from below. Remember, we lose fluids and their dissolved electrolytes in the process. That's why you should drink still mineral water or any saline solutions to replace that deficiency. Next, we need to check if there's any blood anywhere. If you see blood in vomit or stool, it's a serious warning sign. Call an ambulance immediately. The third point is temperature. If we've ingested some kind of toxic substance, it usually doesn't cause a fever. A fever happens due to infection by viruses or bacteria. In that case, you need some kind of special therapy to kill the microbes. The body may eliminate it on its own, as it does with most viral infections. In that case, monitor the fever for at least 3 days to ensure it decreases, and check that abdominal pain and diarrhea are also lessening. And we can neutralize all these toxic, harmful substances with enterosorbents, and in this situation, they really do have a 100% right to exist and to be effective, because there will be something for the sorbent to neutralize. On our own, we can likely do just 3 things. Or 4, control counts, control over your well-being. Don't interfere with nausea, vomiting, and diarrhea. Replenish fluids and use sorbents.
Your attitude towards yogurts and kefir is
great, as long as there is no lactose intolerance and no problems with milk protein.
The last, final, by the way, question is about the main
principles. Perhaps yogurt and kefir are still different because yogurt does not contain yeast, while kefir does contain yeast. And here are the yeasts that are used for kefir. They work with the microflora to further boost intestinal microflora. Yogurt only has microbes, no nutrient medium or yeast, so it mainly just tastes good and passes through.
My final question, Sergei Sergeyevich, is more general. What are the main principles by which you personally eat?
Oh, that's the most difficult question, because I probably couldn't fit them all into our entire broadcast. Well, let's put it this way. I probably don't overeat. If we choose just a few main principles, the first is not to overeat, and the second important principle, before you ask anything from your body, you first need to give it what it needs. This is also crucial when it comes to overeating. If a person skips lunch, they'll make up for it at dinner, and then they won't feel like eating breakfast. So first, give your body resources, nutrients, and energy, and only then expect something from it. So first, have a good breakfast, then your lunch won't be so heavy and you won't want to overeat at dinner. A sufficient amount of fluids and fiber, and coffee. For me,
to be honest, I really liked it. It was really intense. I
added more.
What
many people forget or overdo. And of course, that's fat. You definitely need to eat fatty foods because without fat, the work and life of the gallbladder lose their meaning.
Well, as you mentioned, without fat, the gallbladder will start to leave.
A healthy adult should consume 100 grams of fat daily from all foods. Please provide it. And how?
How does your pyramid compare in calories, protein, fat, and carbs? Roughly, is it 1/3 carbohydrates or 2/3 carbohydrates? How much protein, fat, and carbohydrates should an average person have in their diet in terms of ratio?
I think the first and most important thing is to meet the standard. Meet the standard. That's about 100 grams of protein per day. Well, if we take an average height, average weight person, it's about 80 to 100 grams of protein and the same amount of fat. Also about 80 to 100 grams. And that already gives us 200. And to that we add carbohydrates. Well, it depends on how much a person works, because work is an energy-consuming process. How much they train and do sports is also an energy-consuming process. And how nervous they get, since that also uses a lot of energy. So it turns out to be 1 to 1, and then 2 to 4 carbohydrates. And of course, you need to supplement this with a sufficient amount of fiber. To get 25-30 grams of fiber, eat around 350 grams of vegetables daily. That gives us 1.5 kilo of food.
No, that was a great podcast, really awesome, thank you. Looking forward to more.
Absolutely, thank you.